Hi, welcome to Living Healthy with Amy Turner. Today we have a special guest, Tom Cahoon. Welcome, Tom. Glad to have you on today.
I'm so happy to be here, Amy. I'm excited to talk with you today.
Awesome. Tom and I met a couple years ago when our boys were on a comp soccer team together. And then I learned that he was a chiropractor. And when I started this podcast, I thought of him coming on my show because this is about living healthy and having natural solutions. And so Tom lives here in Morgan, where
Yes.
I live, Morgan, Utah. And he's been a chiropractor for 4 years now.
Yeah, that's correct.
So Tom, could you tell me what got you into being a chiropractor? What sparked your interest?
You know, I worked as a nurse for about 7 years. And as I worked as a nurse for 7 years, I was always a little bit at odds with the philosophy of drugs and surgery fixing everything. And as a nurse, almost the entire time I worked in a hospital setting. And when I was working in a hospital setting, almost all of what I was doing outside of the direct patient care was giving medication. As I was looking for an advanced degree, my wife started to see a chiropractor who did some of the things that I do, and she responded really, really well.
Okay.
She started to see changes in her life that medical doctors had not been able to do. And it wasn't invasive. It wasn't, hey, let's do a scope. Let's stick a camera down your throat again to see what's going on with your gastrointestinal system. And so as I saw her start to improve, I spent some time with this chiropractor. Mm-hmm. And as I spent some time with this chiropractor, one day on the way home from shadowing in his office, I just felt this little nudge of, hey, you should do this. And so about a month later, my wife and I were in chiropractic school.
Okay, awesome.
So it moved really, really fast.
Love it. Thanks for sharing that.
Mm-hmm.
Could you explain what a chiropractor is? Because I know most people out there probably know, but there could be some people that don't.
Sure, absolutely. Most people, when they think of chiropractic, they think about back pain or neck pain or headaches. Mm-hmm. Those are some of the most common things people think about, and we absolutely do that. What a chiropractor does is we look for areas in the nervous system along the spine where there is interference. There's various ways to find that, but when we do, we adjust. We adjust what's called a subluxation. Okay. And as we adjust these subluxations, it helps the body to function better.
Okay, awesome, great. So could you explain some more of the techniques that you do as a chiropractor?
Sure. There are a lot of techniques out there with chiropractic. Okay. Just lots and lots of different ones. The ones that I focus on is I use a tonal technique. And what the tonal technique is it gives you a window into the nervous system to find out what are the most important things to adjust on someone in a particular visit. Okay. And when you adjust those specific ones, those specific subluxations, as I mentioned before, what that does is it allows the body to get rid of not just that, but other ones that have come in to compensate. So when you have a subluxation come, let's back up just a second. What's a subluxation? Okay.
Yes.
The way I explain subluxation is it's stress.
Okay.
It's some form of a stress that's come into your body that your body can't handle quickly and appropriately. Okay. If it doesn't, then it starts to mess with your nervous system. Somewhere along the spine, it's going to start to mess with the nervous system. Okay. And then our body is amazing, so it starts to compensate. Mm-hmm. Now, when our body's compensating, it's not doing what it was meant to do, not functioning properly, but it's trying to overcome it. So when it compensates, you can have up to 9 other places in your spine that are compensating for that one or that primary subluxation. So when you adjust one primary, you can have a lot of other things that help the body immediately. So that's one of the things that I do as a tonal technique. So it focuses on these most important subluxations. Okay. Something else that I do in my office that's not unique, but that's uncommon is I do a non-invasive allergy elimination technique. Okay. And so without the use of needles or long-term avoidances, we can desensitize people to all kinds of things, whether it be the outdoor allergies, food sensitivities, sensitivities to smell, to sunlight, pretty much almost anything that people have a sensitivity or an allergy to. It even helps with true life-threatening allergies of anaphylaxis. So to peanuts or to bee stings or other things like that.
Wow, that's amazing.
Yeah.
And I love how, you said that just that could, let me backtrack to the the one about the spine. I can't remember the word you called it.
Subluxation.
Subluxation.
Yeah.
Thank you. How you said that just fixing one thing could fix a whole bunch of issues.
Yeah.
I mean, to me, that's just amazing, because who wouldn't want something that's going to, fix quickly like that and without using medications and things that are natural?
And Amy, one of the things I've got to mention is I've got to help people understand chiropractic philosophy. Our bodies were built and designed to heal themselves, to be self-healing and self-regulating. The chiropractic philosophy talks about a universal intelligence. I call that God, but it talks about a universal intelligence that created all life.
Yes.
And then there's an innate intelligence within each of our bodies that makes our bodies self-healing and self-regulating. Now, when we've got subluxation in our bodies, it interferes with our bodies. Actually, it interferes with the body's ability to sense the world. It changes the way our body senses the world. So our brain and our spinal cord are, one of the ways I like to explain it is they're like the air traffic controllers of our body. They take the information from all the other systems. They take that information, they make decisions. So if our bodies are sensing the world wrong because we're subluxated, we're going to get the wrong information sent to the brain and spinal cord. And so we're going to get bad information. Bad information means our brains and our spinal cord are going to make bad decisions, or garbage in, garbage out.
Right. Oh my gosh, that makes sense. Thank you for explaining that.
Yeah, for sure.
Okay. And I love what you said about the allergies.
Yeah.
I mean, how amazing that you can just do that test without, again, like you said, without the needles. And I just remember taking my younger son. Actually, Tyson had this done too. And then my youngest son, Cam. And then I did it, going to the doctor, an allergy specialist. Back when, I didn't know about chiropractors and didn't know that,
that there was another option.
Yes, there's another simple option. But they would put all these little, take all the things that you could be allergic to, put on your back. And then, of course, if you're allergic to it, it was like hurting so bad. And I just remember my youngest son, I felt so bad for him because he was so little when it happened, probably 5 or so. And he's just like, just in a lot of pain and, scared and nervous. And, then we found out what he was allergic to and the things. But how wonderful that you can just do something natural like this.
Yeah.
Oh,
I love it, because I've done it on infants, and I've done it on people all the way up to, very old.
Wow, that's wonderful.
Into their 80s. That's about the oldest I can remember doing the allergy work on anyway.
Okay.
So it can work at any age. It doesn't have to be really young. I've had some very, very colicky infants who responded very, very quickly to some light adjustments along with the allergy sensitivities, because they would just get really bad digestion problems every time they ate, even just mom's breast milk.
Interesting.
Isn't that amazing?
Oh my goodness, that is very
it's not a single time, but several little babies that responded just like that.
Wow, I love it that it's for all different ages. Oh, yeah. I mean, how amazing, just an infant.
Yeah, while we're mentioning that, chiropractic works at all ages. When I'm trained to adjust infants, I've adjusted as young as a week old, and when I adjust an infant, think about when you're checking a tomato for ripeness. So you just do a light pressure on there. That's about how much pressure it takes typically to adjust an infant. It's just a light pressure. Okay. I'm not going to be doing bone cracking on an infant. Right.
That makes sense. Yeah, because I appreciate you explaining that. Yeah. Because a lot of people do kind of know it as the bone cracking. I know. So, for example, my cousin.
Yes.
I think he lives in Georgia. I'm not sure. Anyways, he years ago, after he graduated from high school, that's the first thing he wanted to do, and that's the first time I heard of chiropractic. Yes. Actually, he wanted to go into that for his field, and he's I think 2 years older than me. No, yeah, 2 years older than me. Anyways, but he, as far as I know, he does the bone cracking still. I don't know if he does other things. Maybe he does other methods, but yeah, and I remember him doing it on my dad for a little bit and his dad, and they said it did feel better. And, but, of course, like you said, you wouldn't want to do that on an infant. So it's very important you explain that for mothers and out there, if they would think about that.
Other thing I want to mention while we're talking about it is many people equate a chiropractic adjustment with that popping noise.
Oh, okay.
That popping noise is not the adjustment. That popping noise is something that's very common with a more forceful adjustment. I actually err on the side of light. I actually do instrument adjusting. I do very, very light adjusting and use a drop table as well, where part of the table just drops a little bit so that it helps to deliver the adjustment. So I actually don't, by default, do a ton of cracking, so to speak. So that popping noise is actually called a cavitation. And it's nitrogen gas that's escaping from the joint. You ever pop your knuckles? It's the same thing that happens in the spine or any other joint that might pop just like that. Yeah.
Great. So, thank you for explaining that.
For sure. Yeah, I mean, a lot of people think, oh, it didn't pop. That means it didn't go. No, not true.
Right. So what are some more reasons that you think people would want to see a chiropractor for?
So we talked about some of the most common that people think about. Oh, I hurt my low back, or I'm having a lot of headaches, or I've got neck pain, or I've been in a car accident. Any of those are great reasons to see a chiropractor. What are some other things that I've seen chiropractic help? Well, I'll tell you some stories. I love to tell stories. There's a local man who came in and he had been having recurrent chest pain in the left side of his chest, right where the heart is. He had been to the emergency room multiple times and they couldn't find anything going on with his heart. You know, thank goodness they didn't find anything going on with his heart.
Right.
So he came in to see me and I adjusted him. And I adjusted his neck, the very top bone of his neck, his atlas, and I adjusted it one time. And since that very first adjustment, he's never had that chest pain come back again.
Wow. What is so cool.
The body is amazing. The body is intended to heal itself. So when you get rid of interference in the nervous system, when you adjust these subluxations, the body functions better. I'll give you another story. There's another local lady who came in, and she came in and I adjusted her. The next day I adjusted her again, and she came back the next week for a follow-up. And she says, "What have you done to me? My mental health has been so much better." And she knows what I did. I simply did these adjustments. I did these adjustments, and when I did these adjustments, it helped her body to function better. We removed stress that her body wasn't dealing with. And she's continued to have these improvements in her mental health with this continued care.
Wow, that is awesome.
So those are some of the things that you wouldn't even think about.
Right.
Digestive issues can get way better. Constipation, diarrhea can get way better. Pretty much any system of the body is affected by chiropractic. Some of it's more obvious than others, though.
Okay, interesting.
Does that answer your question, or is there more did you want me to go into with that?
Yes, that's great. I was going to say, okay, so as you were explaining all that, then it reminded me of what I wanted to ask you earlier.
Sure.
So, I've seen a couple different chiropractors for a couple of years.
Yeah.
And help me understand this. So, kind of like when you said, that person had the heart issue and then you adjusted one time and they're fine.
Yeah.
So, the chiropractor I've been seeing said, that you adjust one time in that area and then you're fine. It could be, if you have to come back, it could be a different area. It's always a different area. Is that correct? You don't have to fix that. Once you fix the one area, you don't have to go back and fix it again? Or help me understand that.
Sure. So when people say, well, how often do I need to be adjusted? Or do I need to be adjusted the rest of my life? Yes, you do. I don't ever make people do that. I encourage. I get adjusted once a week. I don't get adjusted once a week because I'm in horrible pain. I've had some trauma in my life. I've got some aches and pains, but I don't get adjusted with the expectation that it's just going to all go away immediately or that all of my aches and pains are going to completely disappear. Coming back to kind of circling that back to your question of, do you ever need to be adjusted in the same place again? Oh, absolutely. What caused it to be a problem to start with? It was some form of a stress. It could have been a physical stress, like you slept wrong. It could have been you fell down the stairs, you were in a car accident, fill in the blank. It could have been something physical, but it's physical, it's chemical, or it's emotional. We live in a very stressful world, not just emotionally stressful, physically stressful, chemically stressful. We're exposed. I mean, if we just go from beautiful Morgan County and just go to the other side of the canyon, the air over there is so much worse. We can't control that. So we're exposed to these toxins.
Right.
We have so much toxins on the food we eat. I mean, even eating organic, you might still get toxins.
Yeah, that's true. Yeah.
So what caused it to start with? It's stress.
Yeah.
Being adjusted doesn't mean you're never going to get stressed again.
Right.
That particular subluxation was fixed. It's not, that subluxation is not going to come back. Could you have a new subluxation coming in the same area later? Yes, absolutely.
Okay, in the same area.
Based off of stress.
Okay, thank you.
Does that answer your question?
Yes, thank you. And maybe that's what the chiropractor explained to me and I just didn't, get that part. But yeah, but I'm glad you explained that because I know there's people out there, that think, oh my gosh, they're just trying to get your money. Once you go, then you have another ache and pain or something else to adjust and they want you just to keep coming back. And so I'm glad you explained that because that makes a lot of sense, especially like I'm 53 years old.
Yeah. So
I've had a lot of stress in my life. So that makes sense that I would keep coming back.
Yeah.
Because I want to keep getting this fixed.
Absolutely. Absolutely.
And what I love about chiropractor is that you don't have to go to the medicines, you know what I mean? I mean, and I'm not totally against all medicines. I know that there's a time and a place for nurses and doctors and medicines, and I'm grateful for them. However, I much rather would use natural solutions, and instead of like being on pain medication the rest of my life, I can go get, adjusted and, I don't have to be on the pain medication. I mean, in fact, I hardly ever use over-the-counter medicines or any kind of antibiotics because I use essential oils and other things that are helpful supplements and vitamins to just eating right. So it's wonderful.
It's interesting you say that, Amy. I mean, I've talked with many medical professionals who work in our Western medicine world, medical doctors, nurses, PAs, nurse practitioners, who they don't want to take the medicines either because they know the side effects. Yeah. There absolutely is a time and place, and they do save lives, but it's very, very rare that they save lives. Right. In the United States, we consume about 80% of the world's pharmaceuticals. Wow. And we are not even remotely close to 80% of the world's population. We're over-medicated for sure. A question just in regards to pharmaceuticals, not the purpose of this podcast, but just ask yourself this question. Are you healthier being on more medication or less? And for most people, they immediately are like, oh yeah, I don't want to be on more. That doesn't make me healthier. Right. You're on more because they're trying to manage your diseases. They're not actually trying to get to the bottom. Right. Get to the root cause of your disease. They're managing your symptoms. Right. Yeah. And I agree with you on stress. I mean, everything starts with stress. And that's why we have aches and pains and emotional issues and things like that. Yeah, absolutely. Absolutely. And part of it is in our world, we're actually not taught to deal with our emotions. We're taught to push our bad emotions down rather than just dealing with and living and feeling our emotions. Right. That it's okay. I'm having some sadness. Oh, but that's okay. Exactly. That's okay to be sad. Yeah. Because I would never actually appreciate being happy if I didn't also feel sad. Right. So, thank you for sharing that. Yeah, sure. Exactly. And of course, we're going to be sad when someone passes away or, we got our feelings hurt or what have you. That's normal. We're humans, right? Yeah. Yeah. And I know sadness, again, isn't or emotions aren't really the purpose of what we're talking about here today. But something I was talking with someone recently about is in English, we say, I am sad or I am angry. But if you switch to most of the other Latin-based languages, that's not how they say it. It's I have sadness or I have anger. And in English, we almost like we want to become our emotions more rather than just feeling them. Yes. I feel, okay, well, what am I feeling? Oh, I think this is anger. Yes, thank you. I appreciate you bringing that up because I notice I say I am a lot, and I noticed that what I ended up doing, I just realized the past couple of years through this program that I was doing, and that I'm still doing. It's amazing. But anyways, I realized I was taking upon those emotions as my identity. Right. And I'm like, wait a minute, these are just emotions. That doesn't mean that's who I am. So I appreciate you bringing that up, saying I have. I didn't think about saying I have, but I do say I feel at times, Right. So, I mean, and that's, anyway, again, kind of a tangent, but at the same time, I mean, that's something that I think people really need to understand. And I talk to people in my clinic about all different things as I'm learning new things, because I just want to share. My biggest goal as a chiropractor is to help people be healthier, help people function better, help people to overcome whatever challenges they're having, to deal with them better or to overcome them completely, however that is.
Right. That's wonderful. Thank you. So could you tell me how long chiropractic work's been around?
Sure, absolutely. I actually love this story. I'll tell you a brief story about chiropractic. So D.D. Palmer in 1895 was living in Davenport, Iowa.
Okay.
He called himself a doctor at the time. And back in 1895, you didn't actually have to have credentials to call yourself a doctor. And he did various different things. But he had his practice there in Davenport, Iowa. And in the building he was working in, there was a man named Harvey Lillard. Okay. Harvey Lillard was a janitor in that building. And earlier that year, he had fallen and had lost a bunch of hearing after a fall. Wow. And so Dee was feeling along and felt something along his spine that felt like, that just doesn't feel like it's where it's supposed to be. And he did what we call the very first chiropractic adjustment on him. And after this first adjustment, Harvey Lillard's hearing improved dramatically as a result of a chiropractic adjustment. Now, one of the things I'll say about that is most hearing loss isn't based off of a fall. Most of it isn't physically trauma-induced. So I wouldn't ever claim that all people's hearing loss is going to be improved by that. But that was the first one. That was 1895. And much of what we know about chiropractic philosophy came from D.D. Palmer and then his son B.J. Palmer. And much of what he saw but couldn't prove, we now have science to back up. These things that I talk about aren't theory anymore. They're, we actually have the science to back up what I'm saying.
Wow. I love it. Thank you for sharing.
Yeah,
That's
for sure.
Amazing. So migraines, does it help with migraines?
Most headaches, in my experience, respond to chiropractic care. Okay. The tension or cluster headaches are the types that typically respond the best. Okay. There's various reasons for headaches, lots and lots of reasons for headaches. Yeah. But migraines across the board, in my experience, have responded really, really well to chiropractic care. Okay, great. People either having way less or even a resolution of them. Okay. I love stories again. I'll tell you a story. I had a lady at the clinic I worked at previously who had lots and lots of headaches. She would have migraines at times as well, but she was having headaches all the time, multiple times a week. It was her normal. And we know that headaches aren't normal, even if they're common. Right, right. It took a little while, but after a few months of care in my practice, she was to the point where she was only every once in a while, like once or twice a month, she would have a minor headache rather than having debilitating headaches all of the time. And that's one of the things that I also tell people. Healing's a journey. Healing's a process. For her, it wasn't, I adjusted her once and suddenly everything was better. Headaches are an interesting one where I've had people where on the table, I give them an adjustment. Oh, thank you. That feels so much better. And there's others where it's like, okay, I'll know in a few hours how much good that's done for this specific headache. Yeah. I'll know whether the headache's going to be gone or not. Right, right. Yeah. Okay. What a blessing, though. That's so wonderful. Okay, and I was just going to share that, the chiropractors I've seen, it's been amazing. I've just felt a ton better. My spine, neck, and back felt better. In fact, and it helps with, like you were saying, emotions. Yeah. Because years ago, I got in a really bad car wreck with my 4 oldest kids. And of course I went through lots of trauma because of that, emotional, trauma and things. Physical, no, I was fine, but it was emotional. And so one time when I was getting adjusted, all of a sudden when he was, I think he was pushing on my neck, all of a sudden I felt like I was going to have a panic attack for a minute. And he goes, "Are you okay?" I go, "Well, I just felt like I was going to have a panic attack for a minute, but I'm fine now." He goes, "Okay, just let it go." He goes, "That's okay." And I explained to him what was going on. I go, "I feel like it's from this car wreck I had years ago." And I said I panicked, obviously, and have PTSD from it. And he goes, "Yeah, just let it go." And after that, it just released that panic emotion in me. And I was fine. It was just amazing. Yeah. That's so cool. Yeah. I've had more than one time someone on the on the chiropractic table.
Yeah.
I almost said operating table.
No,
on
you're
the
fine.
chiropractic table, and I adjust them, and their emotions are very obvious, or they start to cry. Are you okay? Oh yeah, I'm just having an emotional release. I've had that happen so many times where people just we're removing the stress. Their body is just being like, thank you.
Yes.
I mentioned infants earlier. One little infant that comes to mind, I was adjusting her. She was squirming all around. You could just tell she was uncomfortable.
Right.
And I just held some light pressure just on the side of her neck, on the side of her atlas there. And you could literally just watch her body go, oh. You could just see the tension just release from her little body.
Oh, what a blessing. Yeah. Oh my goodness. And I bet that mother was so grateful.
Oh, yes.
She was so happy. And
when babies, coming back to babies, when babies are not doing well, it affects not just mom, it affects the whole family.
Yeah.
If baby won't eat, won't sleep, won't poop, it just affects everything to do with that family. And chiropractic care helps. Every time that I've seen it, helps with those issues.
That's so wonderful.
Yeah.
So I've got a daughter that's seeing a chiropractor too on a regular basis, and it's really helped her.
Yes.
And then mentioning car wrecks again, one of my other daughter got in a car wreck a few months ago, and went and saw a chiropractor a couple of times, and it really helped her, and she was fine. Like her neck was hurting, and I said, "Do you want to make an appointment with a chiropractor?" Sure, and she was fine.
Yeah.
And Tyson, who is my producer, sees you on a regular basis. So I would like Tyson to come and share his experiences with you as well.
That would be awesome. Sweet.
So this is Tyson Turner, my son, who's my producer.
Yeah.
And he's going to share his experiences that he's had with Tom.
Yeah. So a few years ago, or maybe it was just last year. Yeah, you know what? It was last year, wasn't it? So last year, or I guess around the end of 2022, I work in manual labor, and I had some crazy, crazy back pain. And I was like, I got to go see a chiropractor, because I've had back pain before. When I was doing manual labor like a while ago, maybe like 2020, 2021 in St. George, I went and saw a chiropractor, and it was fantastic. Everything worked out great. So I started seeing this chiropractor around the end of 2022, and I won't get into details about his practice or anything, but his methods just weren't really working out. It was mostly just machine-based chiropractology. It wasn't really for me. It could work for many other people. It has worked for many other people, but for me, it was not working out. I was spending a lot of money on it every single week. I wasn't getting any better. So then I heard from you that there were chiropractors in this area. I don't know if you were specifically talking about Tom or whoever, but I looked it up on Google, Morgan, Utah, chiropractors, and you were the first one that came up. I'd seen great reviews, and I was like, get me in the queue. And one visit with Tom, and I knew immediately this was working out way better. So ever since then, Tom has been my guy. Yep. And I've been coming and seeing him. At first it was every week, every other week, and then things got a lot better. And I did see massive improvement. And ever since then, it's been 2 months, 3 months within that time frame. And I just went and got adjusted today. Didn't know about this mental health thing. I'll have to pay attention to how I feel for the next few days or whatever. But that's pretty eye-opening, man. Yeah.
So just while you're mentioning it, Tyson, I didn't mention the muscle activation that I do. So
yeah.
Okay, you do muscle activation. Okay.
Yes. So I do a technique that's originally called clinical kinesiology. It is taught under a different name currently as well.
Okay.
But so going back to your injuries and then also car accidents, kind of tying that together. When here in Utah, if you've been in a car accident, you have at least $3,000 of medical coverage, whether you're at fault or not. And you can have higher, but usually you have to request it. So most people have $3,000 in medical coverage. So most chiropractors will see people who have had personal injury for a car accident or something like that. Mm-hmm. One of the advantages that I have and others who do this muscle activation is that there's some very objective ways to help the neck heal. So the other chiropractor I worked with before, the way he talked about this muscle activation is he said, I used to do straight adjusting. He said, once I added the muscle activation, people would respond so much quicker and so much better than without it. And so I do that in my clinic. It does take longer than a typical adjustment. My appointment times are a little bit longer when I know I'm doing muscle activation because it just isn't that quick. Yeah. But it helps so much. And I've had so many people come to the clinic and keep coming to the clinic because it's like, no, I love this. I can feel the change. Yeah. Yes. And I can feel the before and after of that. My muscle's so weak and now it's nice and strong.
Yeah.
Wonderful.
That's what I like the most about your procedure, for sure.
Yeah, so the one I see does the muscle activation too as well. Nice. So I'm so grateful for that. Yeah. I'm glad you shared that because that is what I heard, that it's so much faster and easier. Yeah. And who would not want that, right? And who wants to feel better quicker? Mm-hmm.
Yeah. I mean, for anyone who's coming in symptomatic, I do muscle work. At least for adults anyway. On little kids, I don't do muscle work.
Yes.
But on any adult who's coming in who's symptomatic, my default is I'm going to do muscle work if there's muscles in the area that need some help. Because if you've got a lot of muscles, so for instance, just picking low back, if you've got a bunch of those major low back muscles that aren't working and aren't doing their job, that's predictive of future injury, even if you're asymptomatic, meaning you have no symptoms.
Yeah. Okay, interesting. Thank you, Tom, for sharing that.
You're welcome.
Yeah, thanks, man.
Okay.
Absolutely.
Thank you, Tyson, for sharing your experience about Tom.
Anytime. I'll take any excuse to get in front of the camera for once. So, yeah.
Well, Tom, thank you so much for joining us today.
Oh, it's been a pleasure. I love to talk about what I do. I love to talk with people. I love to teach. That was one of the things I actually really wanted to do was teach. So I love to teach people, whether it be about chiropractic or anything else that I've learned. So
thank you.
It's been a pleasure to be here with you.
And I love how passionate you are about it. And that makes people want to come to see you even more because they know that you really enjoy your work, and you believe in it.
I love it. I've just seen so many miracles, and that's one of my mottos is expect miracles.
Awesome.
I will see them. I will see them in my practice. I will see miracles.
Yes, that's wonderful. Thank you.
You're welcome.
And thank you for explaining about what chiropractic work is and all the information you provided. I learned a lot today.
Yeah. Awesome. I'm glad you did. I hope this video reaches a lot of people and they can learn too.
Me too. So if people would like to come and see you, where could they find you?
Sure. So my website is lifeempoweredchiropractic.com. If you search for Morgan, Utah chiropractor, I'm the only one here in the county currently. At least who practices here in Morgan. And then also you can reach my office at 801-829-1352.
Okay, awesome. And you're Mountain Green, right?
Yes, I'm in Mountain Green. Yep, I'm currently right next to Mountain Green Dental, right next to where they're building the new Lee's Market.
Okay, great. Yeah. Awesome. Thank you. Thank you so much for joining this podcast today and have a great day. Thanks for watching this episode of Living Healthy with Amy Turner. If you enjoyed watching, please be sure to like and subscribe and hit the bell icon to be notified about future episodes. If you would like to learn more, you can comment below and be sure to follow and message me on Facebook, Instagram, and TikTok. Thanks a lot for watching and have a fabulous day.